Hi, everyone. Happy Monday. Welcome back to the show. It's October 26th, 2020. This is Family in Focus on PHLV Radio, and we welcome you back. We're talking about a very important topic today, so we're glad you're joining us here on Facebook Live. You're watching us on PHLV Radio. Facebook. We're also putting us on the Asian Community Development Council, ACDC's Facebook. Of course, they're great people behind this radio show and this podcast as well. They want to get the word out to help educate, empower, and connect the Asian American Pacific Islander community throughout the state of Nevada. And it's so great to have so many experts coming onto the show. Since we started this and getting the show off the ground, we've talked about a number of different subjects and topics affecting people, including, of course, the Asian American community. And today we're focusing in on health. Yes, October is Breast Cancer Awareness Month. You'll probably be hearing a lot about it. So today we invited a very special guest on with us. This is Dr. Jenny Geong Lee. She's the medical director and owner of Sunny Health DPC, or Direct Primary Care, right here in Las Vegas. Dr. Lee, thank you so much for joining us. And I know you've worked with ACDC in the past. So talk to us a little bit about your practice and also your collaborations with ACDC.
Thank you so much. Thanks for the invitation. Yes, so I have worked with ACDC on few occasions. We did Family Day and Health Fair. Before the pandemic, we were doing that in person, but I think this year we changed that a little bit. So I have a family medicine clinic. I have a little bit of women's health background, and we see women of all ages and deal with a lot of different things. So that's what I do in Las Vegas.
Yeah. And, it's so great to have you here because, Breast Cancer Awareness Month, a lot of people still have questions about it. We're still hearing the facts, which are really tough because, still affecting so many women across this country. I just checked all the latest stats this morning. It said that 1 in 8 women in the U.S. will be diagnosed with breast cancer in their lifetime. On average, every 2 minutes, a woman is diagnosed with breast cancer in the U.S. So that's still a lot of numbers. And you as a family medicine, a physician and women's health in particular, you talk with a lot of patients and you say you see women in different stages of breast cancer, right?
Right. Sadly, I have taken care of patients who are stage 4, end stage, who are really at the end of their, really not at that point, treatment, more like palliative care, where they're just kind of managing the very bad symptoms. And I had, opportunity to take care of patients who were much in the earlier stages where there were maybe stages 0, 1, and they were treated and they really were no relapse and they were doing extremely well. So really, I've seen a lot of patients in different spectrum of breast cancer.
And when it comes to breast cancer, of course, you got to talk about the risk factors. What are the risk factors? I know that genetics play a part, but a lot of it is your lifestyle as well.
Right. So a lot of people don't think much about that because, we don't talk about obesity being a risk factor for cancer, but actually it is one of the most important risk factor. Drinking alcohol is also a risk factor. If you drink more than 1 glass, it could be a risk factor for you. Having a stressful life, having a certain diet that you're doing. So those things could actually become risk factors.
And you want people, and early detection, we've talked about that when it comes to breast cancer and many other types of cancers. How important is it for women, especially to go to the doctor at a certain age and start talking about the risk for breast cancer?
I would actually recommend my patients to start talking about breast cancer risk as early as maybe in their 20s or late 30s. Because let's say that if you do have risk factors, then you may be needing to screen earlier than age 40. So I think it's almost too late when you start talking about breast cancer risk and maybe getting a screening test if you're starting that right at age 40.
And with Asian American women, I know we focus a lot with Asian American groups. Are there differences? Because, we've seen studies in the past when it comes to Asian American immigrants coming to this country, their risk compared to women who are Asian American and born and raised in this country. What have you been seeing as, in terms of medical research and backgrounds on that?
So, there is a genetic part of the breast cancer risk that maybe not going to change after you immigrated to a different country. But, when I mentioned about lifestyle changes, diet things that could affect you, then certainly just coming to another country where your lifestyle would change, your diet would change, would certainly add a risk to you, even though your genetic is not changed.
Hmm. And with Asian Americans, of course, we're always talking about food, right? I mean, food is the thing, like for us. But I mean, are there certain types of food that can help decrease chances of breast cancer, or certain foods that make you more susceptible to get this type of cancer?
I mean, in general, I talk about antioxidant food to my patients here. And in general, it's kind of something that is helpful for everybody. Just to put it to simple terms, like, blueberry is an excellent source of antioxidant. If you make a blueberry smoothie, any type of berries is very good. So that's actually very important. But I would say the less processed food, the better it is, because we are talking about kind of getting away from environmental estrogen as well. So even where you put the food in a plastic container would be less good compared to a ceramic, maybe porcelain or other type of container. So there's a lot of other things that we can do to be healthier. Just I'll say keep it simple. Eat a very balanced diet, no processed food if possible, and exercise on a regular basis. Maybe less fat. Maybe moderate protein would be a better form of diet. And not lack of carb. I mean, carb is not always bad, because when we talk about it these days, but complex carb is actually very good for brain function and overall health.
Yeah. And it's just so important, because now, I'm reading more and I'm studying more on health, not just for breast cancer, or heart disease, other types of diseases, how diet can really play a big part, and people don't think about that.
Yeah, absolutely.
Yeah. And I know, when we talk about the risk factors, and you said overweight, alcohol, and drinking alcohol, I mean, that can really kind of play if you drink too much alcohol.
Yeah. And that's, one thing that in Las Vegas, a lot of people do, it's a city where there's a lot of restaurants and places you can go late at night. So really, they don't specify too much, except more than one drink for a female would be considered a little excess, and could put increased risk for breast cancer.
Yeah. And I know there are things that risk you can't change, right? And one of them is being older. So you're still seeing women who are maybe above 40 with that increased risk going up for breast cancer.
Yeah. So, I mean, we can't change aging, but unfortunately, age becomes a risk factor when we are talking about breast cancer risk. And, ethnicity, we cannot change that either, but, certain ethnicity have an increased risk for breast cancer. Being a woman compared to being a man, we are born with a risk factor for breast cancer. So there's things that we cannot change, but we can kind of modify and screen.
And I think that's what kind of been learned. I've been doing lots of stories, in terms of cancer, and men can actually get breast cancer. It's rare, but men can get breast cancer as well, correct?
Right, absolutely. Men can get breast cancer. There is no set guideline as to anybody needing a screening like breast cancer for men. We don't have that. But for women, if any of your family member, you had a positive man with a breast cancer, your risk of breast cancer just went up quite a bit. Wow. So it's something to keep in mind.
Yeah. And you mentioned, and I want you to talk a little bit about this. I mean, we want to talk about the importance of early detection. And right now there seems to be an impact on people getting tested because of COVID-19. Like, what did you find out about that research, and what concerns you as a physician?
Right. So, I know the risk factors, all those things that we mentioned are not really changing quickly, but in the recent article that I have seen in the medical journal was that detection for breast cancer during COVID pandemic, this period has gone down by 52%, which really just means that it's not because people are living a healthier lifestyle. It's just not being detected because maybe people just stopped doing screening tests, which is very worrisome.
And what are the reasons? Are people concerned about going to the hospital right now, or what are you seeing out there as a doctor?
Right. So people are concerned about going to any health facility because they're concerned about seeing other people, other patients. And the other thing is, even the facility themselves that are, doing these tests, they have, a limitation on people, how many people that could be coming in that, specific timeline. So there is a little bit of limitation how many people could be screened in a given day.
And do you have to reassure your patients right now, especially those that even want to come in and see you, that you're, maintaining that social distancing, you're wearing masks, you're protecting both your staff and yourself and also your patients?
Right. No, I can't say 100%, but we do follow the guidelines. So we do use protective equipments and we do social distance. We just kind of have to live though. I still have to see patients. There are
Right.
certain things that I can do by, looking on a screen, but really a lot of times I have to see my patients eye to eye in person. So we do follow those protocols in the clinic.
Yeah, and it's so important. And we wanted to, share a little bit about what ACDC, because you worked with them in the past, and we've had health fairs where people come over. But their ACDC is trying to get out there and get the word out to the community about their services and also help. Just for example, yesterday, this organization held a food distribution event. And also, aside from the food distribution event in Chinatown, they also have a drive up flu clinic. And I believe we have some pictures and videos from that too. And what's really great about this is, a lot of people are so scared, or, like you said, they're not going out to the doctors and getting just preventative care, right? And so it's so nice to see that they did, ACDC brought this out to the community, get, healthcare officials to come out and give people flu shots. They don't even have to get out of their car. They actually stayed in their car, and then people go and get their flu shots that way. And this is a way that they're getting the word out, especially about health insurance as well. And I know, Dr. Lee, you were talking about how, even a lot of people lost their jobs, lost their health care, and that's why ACDC is trying to connect them with Nevada Health Link, of course, with open enrollment starting on November 1st. We did a show on that recently, talking about how for people to get health coverage. So talk to us about that. Were there people that maybe just reluctant to see a doctor because they're scared of how much that's going to cost them?
Right. I mean, I can tell you that I have a cash price, like a membership model family medicine clinic, where it's very affordable for people to come in to get those testings done. And even let's say if you had insurance, for some reason you had a problem with the copays and things like that. When we are talking about like, let's say, for example, breast cancer screening, there are some facilities where they accept cash, and especially at the month of November and October, it's a breast cancer awareness month. So they have discounted price for that kind of service.
Yeah, no, and that's great to hear. And I know so many facilities and different plans look for that. And it's something that people should take advantage of and look into, because it's so important. Talk to me about that, like early detection, just how much it boosts your chances of surviving by getting your tests done early when it comes to breast cancer.
Right. So, there's been a lot of advances in breast cancer. So the treatments are, they've been working on it, and there's a lot of good treatments out there. So let's say if you detected it early, let's say stage 0-1, your 5-year survival is 100%. Whereas let's say you had spread to your lymph nodes, you're approaching higher level staging, then your survival rate in the 5 years substantially goes down as you go up on the stage, and it's very sad.
Yeah. So once a year, especially after age 40, right? For normal women, if you don't have family history, that should be something that you should put on your preventative care plan.
Yeah, absolutely. And let's say if you are, some people don't want to do once a year mammogram, even at age 40. Let's say they were doing every other year. Definitely after age 50, you should really consider doing once a year breast cancer screening.
Yeah, that's good to know. And then I also want to talk and focus in, because, we talk, a lot of our viewers and listeners are Asian American, Pacific Islanders. And, one of the, I think more than just breast cancer and other types of diseases too, there are kind of barriers for them to reaching out to doctors or addressing the issues, whether it be cultural, language. Talk to me about your experience, working with Asian American patients. Kind of what are some of the barriers and how that has helped hindered them getting the health care that they need, especially to prevent a disease like breast cancer?
Yes, first of all, a lot of Asian American, they're very hardworking people, but they kind of put themselves last. They put everything else forward. So they don't necessarily have means to take care of themselves, meaning they don't have the right insurance. They don't sometimes have, they don't know where to go for help. So I think what ACDC is doing, where it kind of becomes like a focus where patients, even if they didn't know what was going on, could actually go and ask questions, is extremely valuable. And it's true. And they're concerned about cost. they're concerned about, talking to a doctor. So I think having the translation services where they feel comfortable and be able to, express their concern is extremely important.
Yeah, and we're actually getting a question, and let me take a look and see from our. So let's see. How do I take care of myself? I have family history of breast cancer. So would you say the first thing is to reach out to a physician, right, to your family doctor, and talk about it?
So, like if it's a primary care relative, we're talking about your mother or your daughter or even your sister. So someone who's very close to you, family relative history is different from, let's say, your cousin, your aunt. So I think the risk factor is a little bit different depending who that family is. But, we do a health risk assessment. So everybody, even if you're healthy or with or without risk, you can easily get these assessments tools online as well. But I think it'll be probably best to go through the doctor. But we do that to see what is your risk based on what you said. But when we're doing this, quick calculations, there is various questions, including family history, any relatives. And if you compile all that information, you probably get a better explanation about where your risk is individually.
Yeah, and my question I have for you, and I've heard this before, is there are different types of mammograms out there. How do we know which one is right for you? Should we pay a little bit more for 3D mammograms? What can you tell us about that?
So, there is a big study out there that's ongoing that's comparing 3D mammogram versus 2D mammogram. But this is just my personal thing is I see a lot of Asian population in general, they have somewhat of a dense breast. So with that being said, 3D would be easier to look at a dense breast. So if we're talking about how sensitive the mammogram is in terms of detecting a cancer, you probably will want to go with 3D if your risk factor is that you have a dense breast.
Okay, that's good to know. And talk to me about what insurance covers. Like, do most insurance plans cover preventative care like a breast exam?
So it may not cover in-person breast exam if that's, but for example, like screening mammogram where you go to a facility to get the breast cancer screening should be covered by most insurances. Yes. In terms of frequency, it could be a little bit different. So I told you sometimes some insurance would only cover every other year for age 40 onward till 50. But most insurances that I've dealt with, it does cover on an annual basis, especially if you have risk factors.
Yeah. And that's really important. And that's why, with ACDC, they've been really getting the word out. And I think we have some information we can put up on the screen, how ACDC is working with Nevada Health Link in order to, talk to people about open enrollment. So right now, November 1st is when you can file, try to get your insurance covered, and Nevada Health Link, that's number is right there. The website is nevadahealthlink.com. The number to call is 702-486. Wait, I just meant that. I think it's 489-8866. All right. So that's the number to call. We'll put this on the comments below as well. So this is where you can get more information. You can also get more information from ACDC. You can go to their website, acdcnv.org. And also you can email them at info@acdcnv.org, or you can also call them as well. So we'll put all that information in the comments below. But yeah, it's just so many people are talking about that right now because now they have to think about insurance, getting covered, and what can be covered under health insurance. So as a physician, Dr. Lee, I mean, you see this on a regular basis, especially now as we're affected by COVID-19. How important is it to just kind of maybe take stock, sit down with your family, talk about what you need for this upcoming year? You never know what's going to happen, as we saw with COVID-19. This just kind of hit us like a brick, right? We didn't know that this was coming. So what kind of questions should we, as a family medicine doctor, should we be talking about our parents, our kids, and everything right now?
I think that, finding out where you stand in terms of the health is important regardless of, whether we're going through pandemic or not. Sometimes, we put, when you're healthy, especially, I don't want to just say for Asian people, but, in general, a lot of people put their health last, especially when they feel that they're young and healthy. But I really think the whole point of screening tests is you want to do it when you're young and healthy so that you could prevent something from happening. So I think if you fit that category, you should really sit down and see what kind of plan, what would help you in the future, and really see what would be the best option.
All right. Well, yeah, Dr. Lee, this is some great information, especially during time when a lot of people are really concerned about their health and they want to stay healthy. So they want to come visit you. And, before we go, I wanted to make sure that we get some information out. If you want to get more information from ACDC, we do have another food distribution event coming up on Sunday, November 1st. So that is next Sunday. If you want to come out and meet members of ACDC, find out about information, how they're helping people, especially as Dr. Lee was saying about the translation services, if you need help with that, they will be there on site. It's going to be happening at Chinatown Plaza, November 1st from 10 a.m. to 1 p.m. So especially if you need free food, groceries, they gave up to more than 300 families, and they're expecting to do the same coming up here next Sunday. We also have the ACDC is also helping when it comes to rent and food assistance. So we have that program that if you're affected by COVID-19, you've been evicted or you're facing issues, paying your rent. If you're eligible and qualified, definitely call that number you see on your screen there, 702-489-8866, or email ACDC. This is open to the public, for the community. If you have this, any kind of issues you're dealing with because of COVID-19, you need help with food and rent assistance, ACDC is helping that as well. Before you go, Dr. Lee, I think we got another question that I want to make sure we address. And since we have you here on Facebook, what are the things I should know about my first mammogram? That's a good question, because for a lot of people, you're very, very nervous. I remember when I got mine the first time, and I did not know what to expect. You hear all kinds of horror stories, right, when it comes to mammograms. So what can you tell your patients what to expect for your first mammogram?
Well, if it's your first mammogram, you want to be kind of ready for going in there, first of all. We generally recommend not wearing any, antiperspirant, because sometimes it could lead to like false information on the mammogram. It could leave like little speckles that we don't want to see. But other than that, you want to be really comfortable for the day. And since it's your first, you may want to pick a facility that you're going to continue going, because the important thing is you want to go to the same facility where they could compare films. It's not like they cannot forward from another facility, but it's just easier if you go to one place where they will see annually what's being changes. Mm-hmm. And when you get the result, generally there's a very simple description of what it read. But the other thing to keep in mind as Asian American is the density. They do also do BI-RADS scoring for the breast mammogram, which is scoring for what it shows. But when I say the density, there's a little different scale, but it does comment on the mammogram, whether your breast was extremely dense or low, normal density. So that's kind of important too, going forward as far as your risk factor for breast cancer.
And I remember the first time I did, because I've never had it before, sometimes the doctor wants you to come back in 6 months, right? Just to make sure that, nothing changes, or if they see something that might be abnormal, so expect that, for your first time, there might be things that comes up.
Yes. Don't be too nervous, because sometimes they're just asking you to come back because your breast maybe was dense. They need to look at it again.
Yeah.
So let's say you're that person, then maybe next year you should consider 3D mammogram.
Yeah, no, that's good to know. But yeah, so many questions you're answering for us today. Thank you so much for this. And if patients want to reach out to you and get more information and about your service, where can they go?
They could go to my website. It's www.sunnyhealthdpc, D as David, P as policy, as cat.com. Mm-hmm. And feel free to leave me a message and I'll get back to you.
All right, Dr. Lee, thank you so much for joining us on this episode of Family in Focus. We'll be back next Monday, and next Monday is actually one day before the election, so a big day. We're going to touch on this topic of last minute questions people have, and maybe a new citizen who has just voted for the first time. That would be interesting to bring them onto the program. So stay tuned for that. And yeah, thank you so much for watching this episode of Family in Focus. Dr. Lee, thanks for joining us, and we'll see you next Monday. Have a great day.